all doing well today. We are back in the anatomy series, and we get to, over this video and probably one more video, go over one of your major organs, that being the heart. The heart. And we're going to start out here with functions and relations of the heart, and then quickly jump back to review the mediastinum, which we've not seen these pages yet, so we'll go over these in a second. But first I want to talk about the heart. The heart in situ, which if we've not discussed before what in situ means, that's the idea of everything's in its exact right place. Nothing has been moved around or anything like that. So we'll get started with the heart, jump back to the mediastinum, and then review more of the heart over this video and one more. So let's get to it. Since the heart pumps the blood, unoxygenated blood to the lungs and oxygenated blood throughout the body. It is located posterior to the sternum in the middle portion of the mediastinum, in the pericardial cavity located between the right and left pleural cavities containing the lungs. The cone-shaped heart points anteriorly and to the left in the thoracic cavity. So, regarding that oxygenated and deoxygenated blood, let's look at that a little bit. So we can pick a spot to start. So we'll go ahead and start with oxygenated blood. So we have blood that receives oxygen from the lungs, goes into the heart, is pumped out through the aorta. So out of the left atrium, into the aorta, down into the portal circulatory system, and then the lower body circulation. It loses its oxygen to our red blood via our red blood cells, and then returns back through the venous system, the inferior vena cava in the lower body, the hepatic veins from the liver, all of this feeding, and then feeding back in through the superior vena cava from the upper body into the right atrium, the right ventricle, and then that blood goes into the lungs, is oxygenated, and the cycle starts again. Topographical relations of the heart. So this is just giving us an approximation of where the heart is in relationship with other major features in the area. So here's the heart itself. And then we've got the left internal jugular vein and the right common carotid artery here, which are major vascular features coming off of the beginning of the heart, coming out of the heart. We've got the left subclavian artery and vein, the ascending aorta, which is taking out that initial freshly oxygenated blood. We've got the pulmonary trunk here, and then the cardiac apex, kind of the point there, the diaphragm in relationship, and then that superior vena cava being the major vascular structure, venous vascular structure, bringing blood to the heart, deoxygenated blood to the heart to go back to the lungs. Alright, and here we have a projection of the heart and the great vessels onto the chest. So, for relationship purposes, the trachea and the esophagus, that left common carotid artery and left subclavian artery coming off of that arch, the left main bronchus, and then the left pulmonary veins running closely to that thoracic aorta. The diaphragm's here, and then the abdominal aorta is just below the diaphragm, giving out oxygenated blood to the major internal organs in this area, so your intestines, your liver, things like that, which we'll get to later. We have the brachiocephalic trunk, which is running behind. So we've got a left lateral view here. I should have clarified that, sorry. We're on the left-hand side looking in, and they have removed the left thoracic wall and lung, so we're looking directly in at the heart, where the lung would be right here. The superior vena cava, the second rib, there's the pulmonary trunk, and then the body of the sternum and the pericardium covering the heart. Here's the heart in situ. Anterior view of the open thorax with the thymus removed and flaps of the anterior pericardium reflected to reveal the heart. serous pericardium, which is the visceral layer. Visceral meaning laying on the organ, so it's the closest. And then there's the serous pericardium, the parietal layer, or the outer layer. So it would be fibrous, then serous, then the visceral layer. The parietal pleura, which is the outer layer of the lung there. We've got the surface of the heart, and then the diaphragm here. And then we can go over the nerves, some of the major nerves that are relevant in the area. That vagus nerve, and this nerve is the one that is, if that's compressed in your neck, along with the vasculature of the carotid and the jugular, if those are compressed like in a chokehold or something, the vein, artery, nerve being compressed in this area is what can cause somebody to pass out. We've got the brachiocephalic trunk, the right brachiocephalic vein. There's that phrenic nerve going down to the diaphragm, lungs, right and left. The superior vena cava, ascending aorta. Again, somewhat redundant, but the best way to learn is to cover it multiple times. The right auricle, which is a feature or kind of like an ear-looking structure on the heart. And then the left auricle up here. The anterior interventricular artery right here. The left ventricle. The cardiac apex. And then here's a new feature here, the ligamentum arteriosum. Ligamentum arteriosum. So it's a ligature structure that's holding these two blood vessels together, or helping hold them together. And I think that's all the features here. Yeah. And again, the thymus and the anterior pericardium have been removed to show the heart. Okay. Actually, before we go to the pericardium, I'm going to go back to the mediastinum because I want to show more relationships of the heart related to other things, or where it's at in approximation to other major features. So the mediastinum is the space in the thorax between the pleural sac of the lungs. It's divided into two parts, the superior and the inferior. And then that inferior mediastinum is further divided into anterior, middle, and posterior portions. So, superior portion, and then the inferior portion divided into three parts, anterior, middle, and posterior. And the middle portion is the heart itself. We've got the thoracic portion of the esophagus in the superior, and the trachea also in that area as well. And just to cover again what features are in the different colored areas. So let's talk about the yellow part. We've got the thymus, the trachea, and the esophagus in there. And then, the superior mediastinum. And then the arteries in that area are the aortic arch, the brachiocephalic trunk, the left common carotid artery, and the left subclavian artery. And then for veins, we've got the superior vena cava, the brachiocephalic veins, the thoracic duct, and the right lymphatic duct. And we'll see that reflected on this chart down here too. Nerves, we've got the vagus nerve, the left recurrent laryngeal nerve, the cardiac and phrenic nerves. And then the separations of the inferior mediastinum. So we'll go front to back. Anterior has still part of the thymus, the inferior aspects, especially in children, because we talked about before how it's huge in young kids and it gradually shrinks as you get older. Smaller arterial vessels, smaller vein and lymph vessels, and then there's no nerves in the anterior portion, likely because it's so close to the sternum. So if you take one hit to your chest, that could be real bad news if there were nerves there, or like major nerves. The middle portion, you got the heart and the pericardium, which we talked about, the ascending or aorta, and the pulmonary trunk, and then the pericardiac or phrenic arteries. For venous structures, the posterior portion. Got the esophagus, the thoracic aorta and branches, the azygous veins, and which is fed by the accessory hemiazygous and hemiazygous veins, and the thoracic duct, and then the vagus nerve runs through the back there. I'll highlight features that we haven't gone over before, but you can also see some of the things that are talked about here in this chart as well, or in this picture as well. We've got the esophageal inlet and the cervical portion of the esophagus. There's some thyroid cartilage here, so that tells us what area we're in there. There's the trachea going down to the lungs, and not to be confused with the esophagus. And we've got the brachiocephalic lymphatics right here. The azygous vein can be sighted right here. Left main bronchus. So we've got a mid-sagittal section, right lateral view, right side looking in. So that's why we can see the left main bronchus. And then the tracheobronchial lymphatics, right pulmonary artery, there. And then the esophagus, the thoracic portion, the left atrium of the heart. So the heart is cut in half here, and we're looking inside of it. Superior phrenic lymphatics, just above the diaphragm and the liver. And then there's the deep cervical fascia, which is composed of the pretracheal layer and the investing layer. I don't know if it's been a while since I've heard that. The investing layer. Left brachiocephalic veins, the manubrium of the sternum, the ascending aorta. The thymus is retrosternal fat pad. So as that thymus shrinks, it's replaced by a fat pad. There's the aortic valve, the sternum, the pericardial cavity, and then this site of attachment between the liver and the diaphragm. Interesting. And then continuing on, let's see, we got the anterior view. The thymus extends into the anterior division of the inferior mediastinum and grows throughout adulthood. At puberty, high levels of circulating sex hormones cause the thymus to atrophy, leaving indistinguishable pieces embedded in the fat that now occupies the anterior mediastinum. And we see that as shown here in this region. Let's highlight some unique features here, or make sure we're oriented. So it looks like we've got the inferior thyroid vein right here. And there's the thyroid gland itself, which has been taken out of multiple pictures that we've looked in this region recently. There's the trachea, the common carotid, and the common carotid artery, the vagus nerve in here, and then the left recurrent laryngeal nerve in here. There's the vagus nerve, the aorta, the parietal pleura, the mediastinal portion, which makes sense given where it is. And then this helps show just the relationship of how close it also is to the diaphragm, the heart itself. And there's even an attachment between fibrous pericardium and the central tendon, or that main portion of the diaphragm, which is very interesting when you see it drawn like that. There's that brachial plexus. I promise in the near future we'll have a video dedicated just to that. It's that series of nerves coming out that handle the innervation of your upper back and arms. The parietal pleura, cervical portion, superior vena cava, aortic arch, major features we know and recognize by now. And then that pulmonary trunk, we've got the left pleural cavity, and then that means we've got the right pleural cavity here. Here's the mediastinal portion of the parietal pleura, so same thing, same structure, just different regions of it. And then the superior and inferior bronchi here, left pulmonary artery, and then right pulmonary veins. And the parietal pleura, the diaphragmatic part. And then we've got a posterior view, so we're looking at the back of the heart. The left ventricle here, it's the fibrous pericardium. Let's see. esophageal aperture, so that's an opening in the diaphragm that allows the esophagus to go through, and then there's another one that allows the aorta to go through. We've got the posterior intercostal arteries, which supply blood to the muscles around the ribs. The diaphragm, pulmonary arteries on both sides. Let's see, the thyroid gland, and then the esophagus. Inferior pharyngeal constrictor. Interesting. Haven't seen that yet. And other than that, I think that's everything that I was going to show for the mediastinum. So we've already covered that part. Alright, so the mediastinum, very busy picture, but it's just a right lateral view, parasagittal section. Many of the structures passing between the superior and inferior, and then middle and posterior mediastinum. So let's look and see if there's, just for orienting ourselves, there's the clavicle and the first rib. There's that brachial plexus again, that bundle of nerves, right subclavian artery and vein, the brachiocephalic trunk, right there. Brachiocephalic vein running right next to it, the right recurrent laryngeal nerve going to the larynx, the left brachiocephalic vein, the trachea itself right here, superior vena cava, the right phrenic nerve, there's the thymus, which again begins to go away once puberty is hit, the right pulmonary veins, and then the phrenic nerve, arteries, and veins all running together in this region on their way down to the diaphragm. And we've got posterior intercostal veins, arteries, and nerves. Remember that veins, arteries, nerves, V-A-N. Intercostal muscles themselves. Let's see. Oh, here's the superior lobar bronchus, which is different. I've not seen that. There's the splenic nerve again, the azygous vein, the sympathetic trunk, the thoracic region. We've got the brachiocephalic lymphatics. We can see that tucked in there. The right vagus nerve right here. And then the white and gray rami communicans. And yeah, that's everything on that page. Here's a left lateral view. It'll be largely the same thing as far as like mirroring right versus left. And by that I mean like you've got a right vagus nerve, you're gonna have a left vagus nerve. But I'm trying to find unique features. There's that ligamentum arteriosum. Find the unique features of one side versus another. And the aortic arch, you're not going to see that on the other side. The left pulmonary artery. There's the rami, the left main bronchus. On this side we do have the hemiazygous veins. And yeah, other than that, that's pretty much a reflection or a mirroring. Alright, so we already covered this portion. And now we get into the pericardium. And the pericardium and then the heart surface and chambers of the heart. Yeah. Alright. So posterior serous layer of the pericardium around the arterial and venous great vessels of the heart. Most of these we've already covered. I want to highlight again that ligamentum arteriosum. There's that ascending aorta, which means that next to it here is going to be the pulmonary trunk. And left pulmonary veins, right pulmonary veins, superior and inferior vena cava, oblique pericardial sinus here, which I believe is where it's the groove for the coronary sinus to sit in, and the serous pericardium, fibrous pericardium, and yeah, that's everything we want to go through there. Posterior relations of the heart. Anterior view of the open thorax with the anterior pericardium and heart removed with a window cut in the posterior pericardium to reveal the structures immediately posterior to the heart. This shows the close relationship of the esophagus to the heart, which is used in the transesophageal sonogram to assess the left atrium of the heart. Basically what this means is, by understanding this relationship, we're able to do like a throat probe sonogram to see a portion of the heart without trying to find it over or through the rib cage. Like externally, you can go internally, go in and use the sonogram probe to see the left atrium of the heart in a different way, in a more easily atypical but more easily accessible way. Got the left vagus nerve, the left phrenic nerve, again pulmonary artery, aortic arch, superior vena cava. Hopefully that's a pattern that everyone's recognizing by now. There's the fibrous pericardium and the cut edge of fibrous pericardium surrounding the termination of the veins, just showing how those veins come up into the pericardium to access the heart. And then here's the anterior vagal trunk. So another portion, a continuation on of the vagus nerve. Alright, pericardium, pericardial cavity and transverse pericardial sinus. We've got a sagittal section through the mediastinum. The fibrous pericardium is attached to the central tendon of the diaphragm. There's the attachment. The parietal layer of the serous pericardium lines the inner surface of the fibrous pericardium, and the visceral layer adheres to the heart. The pericardial cavity, the space between the parietal and visceral layers of the serous pericardium around the heart, is filled with a thin layer of serous fluid that allows for frictionless movement. Where the parietal and visceral layers of serous pericardium reach and reflect around the great vessels, they are continuous with one another. The passage between the arterial and venous reflections of the serous pericardium is the transverse pericardial sinus. Alright, so let's try and get into that and what specifically that means, and then how that will relate to our clinical box down here that we're going to talk about. So we've got the parietal layer, parietal being outside, and the visceral layer being the organ layer on the heart, both of those comprising the serous pericardium, so two portions of the serous pericardium. Here's that pericardial cavity, which pretty much exists to allow for an element of contractility. There's going to be movement. Your heart is constantly moving, so it needs that small gap to move within to be able to pump, because otherwise you are dead in the water. The superior phrenic lymphatics here, which are just going to sit right on top of that diaphragm. And again, another major attachment point is that attachment of the liver in the bare area. So liver to the diaphragm. So it just shows the relationship of how close together the heart, the diaphragm, and the liver really are. Alright, now we get to a clinical box. So having an idea of these relationships, we can now look at what are some of the clinical implications. And if we need to, we'll review this picture to see how it relates. So cardiac tamponade, rapid increases of fluid or blood within the pericardial sac, inhibits full expansion of the heart, reducing cardiac blood return and thus decreasing cardiac output. This condition, cardiac tamponade or compression, is potentially fatal unless relieved. The fluid or blood must first be removed to restore cardiac function, and then the cause of the fluid or blood accumulation corrected. So basically, for whatever reason, clinically speaking, and that's part of what would allow a physician to come up with a differential diagnosis. Something is going to cause the fluid, but in the near term, the immediate term, that pericardial sac will fill up with fluid. So basically, the lining around the heart will fill up with fluid, and it will push into this pericardial cavity. And because of that, it's basically like another layer around the heart that doesn't allow the heart to fully expand to its best potential. And if you're getting a lower, what's called ejection fraction, or less oxygenated blood out of the body, you're going to feel lethargic, you're going to feel weak, you're going to feel terrible. And so what they'll do is they'll take a giant needle and they'll pierce into the pericardium, draw that fluid out to get the restoration of that space in there needed to allow the heart to beat normally again. And then once they've done that and the patient has some relief, then they can start, with greater amount of time and detail, kind of use more of a fine-tooth comb to figure out what on earth is going on that's causing this cardiac tamponade.